Terrific. So I'm a Melbourne-based general practitioner, and I've been involved in prescribing medicinal cannabis to patients for over 3 years now. And recently I was present at the Senate inquiry into the barriers of patient access and medicinal cannabis in Australia. And I would like to share with you some of the key points that were covered in this inquiry and a recent journal article I co-authored, which is currently under review. So firstly, I'd like to present from the two areas, a physician's perspective and a patient's perspective, because certainly there are many barriers and issues that an individual goes through in accessing medicinal cannabis. From the physician's perspective, let's start at the beginning. It starts with medical education, and it's terrific to see Professor Pennington here. I think you were the Dean of the medical school when I graduated. And fundamental to our education is what we learn in medical school. We learned about the opioid system, the sympathetic system, the parasympathetic system, but we never learned about the endocannabinoid system. And this is certainly an important key player in our normal physiology. The medicinal cannabis is recently new to us as clinicians, and it's not come through the usual pathways which have been embedded in our knowledge and understanding for years and years. Typically, there's a clinical advisory group, consensus guidelines, numerous educational courses that we can access to prescribe it competently and confidently as clinicians. So given the newness of the industry, medical cannabis education has been an issue. There's also stigma and misconception in this space. Often doctors don't realize the difference between the illicit black market cannabis, marijuana, weed, ganja, reefer, and the medicinal version, how these are entirely two different products, one for therapeutic use, one for illicit use. Secondly, a barrier to our prescription, to our understanding, to our knowledge, and to providing a good therapeutic outcome for patients has been the cautious position statements by the colleges, which often guide us in what therapies we utilize in our practice. So the position statement from the RACGP which was updated in 2019, highlights the need for quality research into the safety and effectiveness of medicinal cannabis products, stating that the evidence is limited and inconclusive. Also to be utilised after conventional and evidence-based treatments have failed. So as a clinician, the lack of strong guidance or strong recommendations from credentialing bodies such as the college does put in the seed of hesitation. The actual process to prescribe medicinal cannabis has been a challenge from a clinician's perspective. It's not as simple as writing a script. There are legislative pathways that need to be gone down. For example, the special access scheme or the authorised prescriber scheme. And this has been a new field for us as clinicians who often don't need to go down these paths. And this can be time consuming and challenging, an extra step in our clinical management pathway, which for many has been simply a step too far. Supply chain issues has been an issue as well in terms of being confident in prescribing product to our patients. The uncertainty and the interruption of supply chains can influence whether we utilize this as a therapy, because as a clinician, we need to take responsibility for what we prescribe, how we manage our patient, and be confident that what we're providing them with, they're actually going to be able to access in a timely manner. And I've had issues where patients have been gone for a repeat script of a medicinal cannabis product, but when they've been to the pharmacy, there was no supply and they were interrupted for their therapy for a week or so, which had adverse effects to the individual. So the last point that I'd like to make with regards to the clinician's perspective on medicinal cannabis is the time factor. It is a time-consuming process. Most of the conditions that we treat for with medicinal cannabis are chronic and complex illnesses. We need to spend time with our patients, need to take detailed histories, communicate with other members in their team. And for a lot of clinicians, it is a challenge to fit this all in on top of all the legislative requirements. Interestingly, the NPS recently this morning released a cannabis portal, which will hopefully help with education and time management. I'd now like to discuss a patient's perspective, and I'm presenting this from a clinician's point of view in terms of what patients have shared with me. Firstly, many patients come to me and actually say they were unaware that medicinal cannabis was an option in the first place. They're not aware that it is a medication. It's not just on the black market. And a recent article, which was published by Linciris, highlighted that sometimes for patients, it's easier for them to turn to black market versus medicinal cannabis. Why is this? Well, firstly, it can be really hard for a patient to find a doctor who is happy to prescribe them with medicinal cannabis. There are cannabis clinics which are available, but their long-term doctor may not be open to it, and that may shut down their conversation in terms of them being comfortable accessing this as a treatment. And this then stems into the fear and stigma associated for some patients with regards to medicinal cannabis. If I think of a recent patient I saw from a country town in Victoria, she was actually concerned about taking her script to the local pharmacy because she did not want the community to be to know or have an inkling that she may be utilizing medicinal cannabis as a therapy. So the long history and the black market illicit medication does sometimes create fear and stigma for patients who don't recognize that this is a terrific medical therapy for them that they could utilize. Driving is a significant barrier for a lot of people, and the lack of distinction whether a person has been impaired by medicinal cannabis or not versus whether it is detectable in their saliva or urine has not yet been made. And for a lot of people who need to drive for their livelihood, for caretaking responsibilities, it means it's a significant barrier. And lastly, there's the medical bill and the cost. So currently it's not subsidized by the PBS. It's an expensive therapy for a lot of people suffering from chronic complex illness on disability pension or who have their working life shortened due to illness. So for these reasons, medicinal cannabis has had issues in terms of becoming extraordinarily popular since the time it was legislated for. However, on the upside, for the 3 years plus that I've been prescribing it, 2020 looks a lot different to 2018. What's available in terms of educational resources, what's available in the press and the media, access to other doctors who have insight and experience in prescribing it, and clear competence. The leaps and bounds that the industry has made, and as mentioned by Dr. Pennington, the research that is currently underway is phenomenal. So I think the road ahead is great. I think medicinal cannabis has great potential in providing precision and personalized medicine to patients that dearly need it for conditions that cannot be treated with the current therapies on the market.
Fantastic, Dr. Nation. Thank you so much, and good morning. That's a smile. You can hear me.
Yes.
Oh, that's a bonus. Apologies there. I was all ready to pump your tyres up with a sterling introduction, and unfortunately I dropped out 3 times, but thank you for soldiering on. Look, from my perspective, I've been working as a medical access lead at Cannatrek since November of 2018, and through that had the opportunity to sort of assist patients, doctors, pharmacies through the process to attaining a script for medicinal cannabis. And one of the early things that you spoke about was education for the healthcare professional. I guess I'm just wondering, from your perspective, and a GP who's been in the process for a long time, very experienced, very educated, what do you think is the sort of minimum education required for a practicing GP today who didn't have that opportunity through university? And secondly, what are the current pathways to attain that education?
So firstly, I think, as with all medical teaching, the key is understanding the physiology of the endocannabinoid system. As a doctor, you need to be competent and confident in understanding the mechanism of the therapy that you're prescribing, because patient care and safety is utmost in all our clinical decisions. So a fundamental understanding of the physiology. And then, as this medication is in various forms for various indications, an understanding of the pharmacology behind the different methods of delivery and the products available in terms of CBD and THC. On top of that, there then is the clinical aspect of it, which is the various conditions, and that's looking at the evidence available via journal articles or courses, which can guide you in terms of your prescribing pattern. Ideally, Craig, it would be fantastic if there was some credentialing available, and there are. So I know Teresa's speaking today. So Medwana provides a CBT course, and also ACNM has provided courses. The college itself has occasional webinars. So there are educational access avenues right now that any doctor can find. I remember when I started on this journey, I actually had to travel overseas to educate myself more, and that's certainly not the case anymore.
Yeah, fantastic. Hey, just quickly, I've had a request from the tech side that you stop sharing your screen, and that way the people out there on the other end of this conference will be able to see our faces. Lucky them. Yeah, all right, fantastic. That's the education side. I guess just another aspect that came up from both the clinician and the patient aspect was the stigma associated with medicinal cannabis. And I've certainly spoken to plenty of GPs within Victoria that sort of state that they don't want to start prescribing medicinal cannabis due to the fact that they don't want to attract sort of what they consider to be the wrong clientele, the chronic recreational user. I guess firstly, I'd just like to ask for you to reflect as a prescribing cannabinoid clinician, what's your experience been in terms of the new patients that come in the door, knowing that this is a therapy option for you?
So I can 100% agree with you. When it came to the forefront, I was similarly cautious and not sure what was going on. Where did this medicinal cannabis come from? I was not confident that I was going to use it. I think being patient-centered as a doctor is what drove me to educate myself, and therefore not be a barrier to my patients having a therapy which could provide them with significant benefit. And I think that's from an individual doctor standpoint in terms of what they're comfortable entering into, and we all need to have our limits and our boundaries. But there are a lot of clinicians who are patient-centered, and if they feel that their patient needs or deserves a trial of therapy, and they're willing to go on that therapeutic trial of therapy with their patient, then the stigma can be removed from the whole process.
Yeah, fantastic. I think that's amazing feedback. Thank you. And we've actually just had a comment come in that massive stigma as a patient as well. Try talking to people about mental health and then about using medicinal cannabis to treat issues with it. Double stigma. And I guess that's a really valid point, that there's certain conditions that patients are experiencing which already have a social stigma attached, and to be treating it with another stigmatized product or medication, I guess involves an extra awareness from the doctor. Would that be fair to say?
100%. As a clinician, my role is to provide objective, considered and efficacious therapy for any individual that comes through my door. And that's the code that I practice to, which has enabled me to educate and provide this therapy to people.
Yeah, absolutely. And just, I guess, a final note on stigma from an industry perspective, and, you know, I sit on the side of the medicinal cannabis industry in Australia. Are there any insights or feedback that you think the industry as a whole should be undertaking to try and spread the word about the therapeutic benefit of medicinal cannabis?
I think over the past 6 to 12 months, what you've achieved is amazing. And the infrastructure that you're providing to Australians in terms of jobs, the infrastructure in terms of agriculture is amazing. And there's, as we get, you know, more clinical trials published, I think, you know, as a community, as a global community, it's a product that is going to revolutionize medicine in the way that it is natural based versus synthetic, in the way that it can provide personalized and individualized medicine, which is we don't really see with regards to dose titration with the fixed dose pharmacotherapeutic options.
Yeah, absolutely. Look, I've just had another comment or a question really from a familiar name. How do you suggest patients approach doctors that are unwilling or unaware of medicinal cannabis? A lot of doctors outright refuse to help patients that are interested in cannabis as a medication. And awareness was certainly part of your patient access factors. So yeah, can you highlight a little more how you think patients should approach that?
So it's with, if you think about a lot of the clinical conditions that clinicians may have their own personal views, one, that shouldn't ever come into the picture. So if a doctor is not comfortable prescribing it, then they need to be comfortable referring their patient on. It's the same with abortion, so termination of pregnancies, it's the same with addiction medicine. It's our duty of care to our patients to give them medical advice, accurate medical advice. And so a simple way would be, look, as if I was a patient looking for medicinal cannabis from my GP, I said, look, I've heard about this therapy. I really feel that it could benefit me. I was wondering if you're comfortable looking into it for me. So it's an open conversation and it's shared decision-making, because that's what good medicine's all about.
Yeah, absolutely. And look, this is a fireside chat, and we're in much need of a fire this morning in Melbourne. But I guess I just, it's from what I've seen, once again, on my side of the industry, where we have lots of patients calling in, inquiring about how they access medicinal cannabis. And the comment is often that they've spoken to their regular GP, and their regular GP is either outright refused or just said, yeah, good luck to you, but go and find out. Go do the research and find out how to access it yourself. And what I'm starting to see here at the moment is, it's quite a complex matrix between the difference in education between the most knowledgeable doctors in Australia prescribing medicinal cannabis and those that will not even consider it at all, intertwined with factors like stigma and general access issues. And you've highlighted the progress that's been made in the last 2 years. I guess in considering that, I'm very excited to see what that progress away and making that matrix a little less complex over the coming 2, 5, 8 years will look like.
Yeah, 100%.
Yeah. Something else we've touched on is evidence. And perhaps a bit of a curly question, but there seems to be a bit of a disconnect, to me at least, between the traditional Western pharma approach of isolating an API and, getting it essentially in a tablet form at the end that can be dose regulated very tightly and sort of mass produced, versus medicinal cannabis being generally a whole plant medicine. I guess, do you have any insights or thoughts on the way you see that clinical evidence and side of things progressing? And another double-barreled question, but where it fits overall in the scheme of medication versus what doctors are traditionally used to prescribing?
I think it's a terrific question that you pose. I think the future of medicine is precision medicine and personalized medicine. And medicinal cannabis is a great therapy that fits into that, under that umbrella. If you think about how we review now SSRIs for the management of anxiety and depression, you can do genetic testing to see whether people are fast or slow metabolizers, why the medication would or would not have been a good fit for them. So medicinal cannabis very much to me is like that. Different batches, different products have different terpene profiles, have different cannabinoid profiles, which may or may not have efficacy for an individual patient. So this is where we as a clinician can really nut it down with the patient to find them a therapy that will suit them in a very accurate and specific way. And yes, not everyone is going to have a positive therapeutic outcome, but it enables us to practice precision medicine in a way that paracetamol doesn't.
Yep, absolutely. Sorry, just a question or comment here from Dr. Tony Hellman, who's another Melbourne-based doctor. Would it not be a good idea to maintain a list of prescribing doctors that patients could access? Now, certainly from my perspective, when we get those patient inquiries about how they can access medicinal cannabis because their doctors refused, we sort of provide them with a long list of doctors we're familiar with in Australia that can prescribe. It's certainly not, it's very closed doors, let's say, on a TGA type level. What are your thoughts on, I guess, doctors either being able to advertise their ability or willingness to treat a patient with medicinal cannabis and the availability of such information for the patient population out there?
First, I think patients always have a way of finding a clinician, which is good, but agree. Look, my honest opinion would be that if a patient's regular doctor was able to care for them and actually treat them with the therapy, that would be in the best interests of the patient, because these are chronic complex conditions. And it's not just about the pain. Pain involves gut health, it involves mental health, it involves musculoskeletal function. And medicinal cannabis is just one part of the picture. So I think the key, for me as a doctor, the key would be more doctors being comfortable with it so that it wasn't so onerous on patients having to locate specific entities. In terms of a list, certainly I'm not sure in terms of from Canatrec's perspective whether you're allowed to publish a list of prescribers. As a clinician myself, the TGA has strict rules in terms of how I can or what I can put on a website, which where I'm featured. So the medical profession is very closely monitored from an advertising perspective.
Yeah, absolutely. And yeah, look, to all the patients out there, I guess Google is still a friend, and there is information with regards to some exceptional doctors who are experienced in this field available should it be searched for. I guess that'd be my closing comment. Is that fair to say?
Yes.
Now I feel like a bit of a morning radio presenter here. There's plenty of question and comment coming through, and I'm starting to lose track of them all, which is it's good actually. It's good to see some. This is stimulating some discussion. One here, Dr. Nation, with your interaction with the federal government, do you see real, in inverted commas, support from them to further develop the medicinal cannabis industry in Australia?
So my interaction was presence at the Senate inquiry, and as part of NIM where I work, being present there. From what I've seen in terms of as a medical professional, seeing the NPS this morning in my inbox provide a medicinal cannabis portal, seeing the Australian Medical Association, AMA, having special accessing guidance documents, it's clear to me that the government has an interest in ensuring that this therapy is explored and utilised by the medical profession.
Yeah, very much so. Yep, absolutely. Another here, would you prescribe more medical cannabis if more pharmaceutical formulations were present in the market? For example, nasal nebulizer or other administration forms that could reduce the dosage necessary?
As I said, in my clinical practice, I personalise the medicine as much as possible. So if a person has gastrointestinal issues, I would prefer to use something which is buccal absorption or an inhaled absorption as another option. So certainly if there were creams available and there was evidence behind that formulation being beneficial for conditions such as psoriasis, that would be a positive. So in whatever therapy we provide, we have to think about the minimum possible dose for the maximum possible effect for the minimum possible side effects. And that certainly guides my clinical judgment.
Yeah, absolutely. And I think I would just comment that it seems to be a very, well, it doesn't seem to be, it is a very dynamic picture, the Australian medicinal cannabis industry and the global medicinal cannabis industry in terms of therapy. And there's so much research going into new administration, new forms of administering medicinal cannabis is the word I was trying to say. I think there's a presentation around 4 p.m. today on the sativa wafer and how that works and bioavailability and how do we, once again, minimize dose for the best outcome for the patient. But once again, all part of the sort of what at the moment is a complex matrix for the Australian scene. But certainly it's all part of opening things up for the future and having better information, better administration, and getting this to be an accepted medication, do you think?
100%. Patient care and patient outcomes has to drive us.
Yep, absolutely. And look, I really want to, we've just had a couple of comments come through along the same theme, which has been an interesting one for me over time. You talk about the role of the GP prescribing. What about specialist prescribing? And as a second part to that, how do you see specialists and GP working together to provide optimum care for patients?
That's a great question. And I think medicinal cannabis has been useful in terms of, especially if it's got a significant THC component, there can only be one S8 permit holder in the picture for that particular patient. So firstly, I think working together is all about everybody being on the same page. So if you're a general practitioner versus a neurologist, you would need to liaise together to ensure that the therapies provided were efficacious and not going to be contraindicated or cause harm. Who takes the role of being the lead prescriber in the process for a patient would really depend on the two clinicians. If you had a general practitioner who was very confident and competent with cannabinoid medicine, then clearly they would take the lead. If it was a specialist who was clearly competent and confident, it would be reasonable for them to take the lead. As clinicians, we all have to work together, and we've been doing this for years in order to provide the best patient care. And all of us are aware of this relationship and how we work as a team.
Yeah, fantastic. And I guess it'd be fair to say that, you know, that presentation around the physician perspective certainly specialists have exactly the same barriers as GPs to prescribing medicinal cannabis and education, becoming familiar with it, the evidence side. That picture doesn't change between specialist and GP.
No. I mean, we've all been through medical school. We all understand the key components of patient care.
Mm-hmm. Look, I think one of the, I guess, most publicised aspects of medicinal cannabis that you spoke about towards the end of the patient perspective is cost. And, you know, there are certainly costs associated with medicinal cannabis on both the prescribing side and the medical side. Now, I personally still see numbers in the news around 40,000 a year, 50,000 a year. Are you able to provide any feedback on what you think's a sort of average cost for a patient, particularly, I guess, on the medication side for you? But
it's a really good point that you raise. I, as a clinician, I have a blanket statement that this is not subsidised by the PBS. This is an expensive therapy, and cost will vary. As a doctor, I always try and prescribe for my patient the best possible therapy that's going to be efficacious for them. And cost is typically not my first consideration, because there are issues that a product that you prescribe may not even be effective. If it is effective for a patient and there is a barrier with regards to long-term use of the product and they cannot manage the expense of it, then I will look at cost-effective options and liaise with the representatives of the companies to see whether there is anything we can do for this particular patient. And amazingly, I have found the medicinal cannabis companies as accommodating as they can be, which I always find heartening as a clinician in terms of patients in remote and difficult to access places being cared for. And as a clinician, I've had to form better relationships with the medicinal cannabis companies, yourself included, in order to ensure that I have best patient care.
yeah, fantastic. And I actually, when you were talking about that, I got a bit of it warmed my heart as well. The approach I see from many of the suppliers in Australia, and you know, everyone's sort of trying to get up and running, but also facilitate that access aspect at the same time and reduce costs. And I guess on the cost side, it's something we have seen coming down in the Australian industry over the last 12 months, and I do believe that'll continue to happen. And I guess the flip side for me is the conversations I've had with both patients and doctors that traditionally medicinal cannabis has attracted some of the patients in Australia that are most desperate for a better answer to their current health status with the conditions they have. And often that initial barrier of maybe $200 a month, if the medication works for them, all of a sudden is worthwhile.
Yes. Quality of life is not to be discredited as a driver.
Yep. Yeah, absolutely. I guess it's something we all want, isn't it? Look, we are coming to the end of our little chat here. It's been an absolute pleasure. Are there any closing sort of statements or remarks you'd like to make based on the discussion we've had for the people out there that we can't actually see?
I'd like to thank you for your time and the opportunity as well to present. And I'm actually really excited with regards to what the future holds for medicinal cannabis as a clinician. I think for a lot of clinicians, it's opened up their practice in a way that we wouldn't have considered possible, and opened up the way that we can practice medicine to really deliver great personalised outcomes for patients.
Yeah, fantastic. Thank you. And thank you so much for your time. And look, today I think, or I hope today will be of great interest and benefit to everyone out there. We've got some amazing panelists, and certainly in respect to a comment before, there's specialists and GPs all presenting on sort of current research and how they approach patients clinically. I think it's going to be a stimulating, fascinating and amazing day. So Once again, Dr. Nation, thank you so much for your time. It's been an absolute pleasure. And take care.
See you.
Thank you. Bye.